Hi, friends. Welcome back to the Bright Side of Beauty podcast presented by Beyond Skin Aesthetics. Today's guest is truly a pioneer in the aesthetics industry, and I have been so excited. I've actually been sharing with my friends in the industry that we were going to be recording today, and every response was, "Oh my gosh, she's a friend of our company," or "Oh my gosh, she's a friend of so-and-so. We love her so much." And I think that that just speaks to the person that Alisa is and the leader that she is, not only in the industry and in her business, but just in the world as she is navigating through kind of blending her personal life with her professional life and all of her passions and just the beautiful person that she is. So without further ado, I would love to welcome Alisa Lask, the CEO of Rion Aesthetics, Plated Skincare, for those that don't know the overhead name of Rion Aesthetics, to the Bright Side of Beauty podcast. Thanks for joining us, Alisa.
Thank you so much for having me.
I'm so excited to dive into really what is regenerative medicine, what is plated skincare, what are plated exosomes, all of the things together. So if we can, let's just dive straight into the nitty gritty. What is regenerative medicine and how does that tie into what you were doing at Rion Aesthetics?
Yeah, great question because regenerative medicine has been thrown around for a while now and it's kind of creeping into aesthetics. We're calling it regenerative aesthetics. But really, as it relates to aesthetics and kind of skincare, it's really about how do you tap into the skin's ability to renew. So it's not about covering things up, it's really about supporting your skin to renew so you can have that young, youthful glow. And what we're really finding in terms of aesthetics now is that there's new ingredients like these exosomes that have really elevated what we're able to do with our skin.
Can you tell us a little bit about how platelet skincare came to be and kind of just the history of the company?
Yeah, so our two founders are internationally recognized regenerative medicine experts that work at Mayo Clinic, and they were in the lab studying stem cells for heart attack patients. So they were trying to figure out, what they can do with regenerative medicine. These patients that have a heart attack to, save their lives, really. And they made this discovery that it wasn't about the stem cells; it was about these exosomes that were really providing kind of the key to success. And as they were going through all of that, they were in the lab, like, working with this platelet exosome, kind of a product, and they were putting it on their hands, and they noticed that their skin was starting to look better. And, you being a female leader, I think you'll appreciate that it was actually the wife of the founder that said, "Wouldn't it be amazing to take this technology and use it in skincare?" And he's like, "I'm a cardiologist. We're focusing on heart transplant and heart patients." And she really, kind of took the product, focused on coming up with these wonderful formulations that we have today. And her ethos was that we're going to be transparent. We're not going to hide behind the source ingredient. We're going to call the product plated because our product's ingredient comes from platelets, and really be true to kind of what we're doing, which is taking skincare and ingredients to a whole new level.
What I love most about that is it's a female visionary that saw how to truly bring the beauty of the consumer out from a natural standpoint. So, this isn't necessarily just adding fluff at the surface. This truly is healing the cell and healing the body from within, healing at the even dermal, epidermal layer to show just your true beauty. And that is such a magical thing. I absolutely love that. I think that the use of exosomes is kind of controversial at the moment. Why do you think that that is?
Well, I think this word exosome is starting to get thrown around in front of all the education, right? Products are slapping it on that have been around for 20 years. Plants that were extracts are suddenly plant exosomes. And I just don't think people understand. So if you think about an exosome in your body, we have thousands of exosomes, and their job is simply to send messages to the cells. And there's all kinds of messages. You could have a message that signals renewal, but you could also have a message that signals, inflammation. But what we've been able to find is that using this source of platelets, we can get a special message in our exosomes that signals renewal and has a unique ability in the skin to really get all those things that you're looking for: the luminosity, the appearance of redness and wrinkles improved. Just a very simplistic approach to skincare.
Absolutely. That is my personal favorite too. So I am a rosacea girl. I have flaming red cheeks most days. I am just extremely reactive to all of the different triggers. And for me, I thought calm was going to be my method of madness. And I loved it for so long. And finally, I believe that it was actually Sherry who mentioned maybe try intense, just mix it up, try intense. And as soon as I did, it was absolutely incredible. So now I lean more into calm post procedure or even paired with procedures for like immediate topical use as a provider. And then using intense as more of like that daily routine. But then daily is also an option. Can you speak a little bit on why daily was brought to the market?
Yeah, so the reason why we brought daily was to really have something that was meant for people that were less like younger, not as damaged of skin, really looking to kind of protect. One of the physicians like to refer to it as almost the internal sunscreen that you're using. Um, it was meant for once a day application, and and really in a little more, it's a little more cost effective. So you get a little more in the bottle. It's also just a little bit thicker. So some people like just a little heavier serum. So it's a little thicker, a little more moisturizing, and really depends on the climate, right? Sometimes when I'm in Florida, you need one thing. When you're, somewhere dry, you need something different. So it really depends. Every skin type is a bit different. But we find that a lot of times people also will start an intense and transition to daily. So I think it's really that's why they, need wonderful providers like yourself to help educate what's best for them. Um, but that's really why I was created.
Absolutely. Why would you say that providers should be talking about plated while in the treatment room for use as a take home product with procedures?
Well, listen, plated is going to amplify any of the treatments that are being done. We've published some really great data around post procedure, kind of that reduction in the appearance of redness, just this whole downtime and recovery. Like we all want to go do these things, right? But then we think, oh, I have a wedding next week. I have this. I can't do that. I can't be in the sun. And so we want that downtime to be as short as possible. And I think that plated pairs very well with our goals to get back to looking, like we look every day after we do some of these procedures.
I love the timing of plated coming to the market as well. Post pandemic, I believe that everybody is so excited to be out and living their lives. And there really is a focus on not having to slow down, not having that downtime, and just really not having to skip a beat. And I hear that a lot from my patients that are coming in. They want to have as many treatments done at the exact same time. And then when they leave, they want to have zero downtime, if at all possible, or as minimal of downtime. And that's where I feel like plated comes in immediately to help to signal to the cells to start that recovery process and cut down on that recovery time. And it is an incredible tool as a provider, but then again, as a patient that wants that minimal downtime. But again, like I mentioned earlier, this isn't something that you necessarily have to pair with a treatment. You can use it independently as a treatment in itself. It's going to be treating the reds. It's going to be treating if you have issues with browns, if you have luminosity issues, texture issues. It's really going after all of these different multifaceted kind of components to the skin. And what I love too about this love letter that it's writing to the cell is that it's really addressing what you need, not what maybe I need. And so it's going to address what your needs are with your skin at that time and help to again bring out that brighter you. I do want to bounce back for a second to talk about the difference in exosomes. So there are many different types of exosomes sourced from different places on the market. And when you say it's human derived, that can sound very scary or like very icky. What how would you describe that to the listener that maybe doesn't know what that means or is thinking of more of like the stem cell side of things versus, or like the umbilical cord extracted
Yeah.
exosomes versus platelet derived?
Yeah. So, I mean, our founders spent 20 years studying stem cells. So, these are stem cell, famous, internationally recognized stem cell scientists. And so, their discovery was it wasn't the stem cells that were doing all the great things that we wanted. It was actually the exosomes. And that's why, when we think about the different sources and kind of where we get them from, it's really important that you get the one that's doing what the job that you want it to do. And you can feel very confident that with all this research, they've really figured out that you're not getting anyone's DNA, you're not getting anything you need to be worried about. It's literally just that exosome with its goodies inside, the contents inside of it. And that's what it loves, it's so great. Everyone loves about kind of the how their skin looks after they use it. But it's a very, very sophisticated process. This is why we haven't had human derived ingredients for 30 years, right? It is high science. It's very, very complicated, but science has caught up through these discoveries to allow us to be able to have these things in skincare where we don't need to be worried about, kind of these human derived ingredients. Like it's a very, very safe arena.
What do you feel like the future of regenerative medicine has in store for us? What do you think is on the horizon from that side of things?
Yeah, I mean, listen, I think in the big picture, regenerative medicine is going to be, like what we're all talking about. And actually, Rion, our parent company, is doing a lot of medical studies with their medical grade exosome called PEP. In fact, Ohio State is actually recruiting patients for knee injection, so osteoarthritis. So it's one of our sites for the many trials, but they're studying wound, cardiovascular disease, stress urinary incontinence, like all these wonderful things are being studied. And we're just on the forefront of getting them, in through the FDA and approved so they can be in the hands of doctors. So I think that's on the medical side. I think if you take that learning and you apply that same medical grade PEP exosome to aesthetics, we're starting, and we just, we're gonna have a press release here soon, but we just started via an IIT, which is an investigator initiated trial, injecting these exosomes so we can eventually, work with the FDA and do all the trials to get it and hopefully an approval for injectable hair treatment. Because if you think about it, now we do PRP a lot, right? So, what is part of PRP, right? Exosomes. Why does PRP not work every time? Because one night you have a burger, one night you don't sleep well, and your exosomes are all over the board. Your PRP quality isn't. And what we're going to be able to provide is these exosomes in a bottle, like regenerative medicine in a bottle, and hopefully, be able to help with hair restoration. I'd like longer term, instead of having filler or something you just put in, it fills. We actually have a true biostimulator, right? Something that can signal the cells, grow elastin, grow collagen, reduce cellular senescence, which is those zombie cells that we don't like because of aging. So I think we are just on the forefront. We're just getting started. And, I think the biggest thing though is, just right now, today, there are no exosomes that are FDA approved for injection. It is not safe to be doing that. And if someone tells you it is, go look, do your homework. There is no FDA approved injectable exosome. And that's where you start getting into trouble, right? Where they're not doing the right virus screening. You don't understand the source material. Like we are spending tens of millions of dollars with our, with the source material and doing the manufacturing and making sure it's safe. You can't just like pull exosomes from any umbilical cord or stem cells or whatever and then inject them and assume that they're going to be good. There can be bad things that come. So I think right now, exosomes in skincare and just making sure you understand the source and the company you're getting it from, and don't be, the shenanigans about plant exosomes. I won't be, I won't argue with you. Plant exosomes are like plant extract. They're the things we've been using all along, but
Mhm.
plants don't have the same power that human derived ingredients can have.
Thank you so much for mentioning that. I'm so glad that you mentioned that because the safety of injecting exosomes and it not being FDA cleared at the moment is an extremely important point to mention, but also the use of plant exosomes or plant extract, are they fantastic to use? Absolutely. Do they equate to the exact same thing? No. We're talking about two completely different things. But I believe that exosomes is such a hot word right now. Everybody's grabbing onto it. So, truly understanding what you are using, if it is working, is it sourced in a way where it's sending that hate mail or a love letter? That is all extremely important knowledge to have as you're moving forward from a patient or from a provider standpoint. You want to be able to trust what you are doing. And from a provider standpoint, I want to be able to trust what I'm sending home with my patients because ultimately their outcomes fall back onto me, not necessarily the products using. So partnering with a company that is making sure that it is backed by science, it is efficacious, and that it is driving results is so, so, so important. So I appreciate you mentioning all of those things. Can you give us a sneak peek into what's coming down the pipeline for Rion Aesthetics and Plated?
Yeah, absolutely. So, I think we're continuing to innovate. Our whole team in Rochester, Minnesota just loves innovation. I was just there. I just came back from a weekend and looking at new things. I think we're looking into, we get a lot of requests for body serum, people just want to bathe in it. So we're trying to,
Yes.
work on formulations for that. Listen, we all have areas like above the knees or the arms. So there's all things, areas that we want to work on, my neck, my décolletage. So I think we're working on that. We just launched our eye serum recently, which we've gotten really rave reviews from. And I think we're going to continue to innovate as we, I think the future is really what other, ingredients can we, really elevate, continue to elevate the exosomes. We continue to add to our formulations in different areas. We've had requests for brow and eyelashes and nails and hands and all these other things. So we're exploring every one of those. And then I think, like I said, on the longer term side, we're really working hard on some of these FDA programs that will really change the face of what we're doing in injectables in aesthetics. And I'm very excited about those as well.
I'm so thrilled to be partnering alongside you and get to see what innovations come. Just mentioning brows and lashes and everything, I have totally thought about using a little spoolie brush with hair and putting it on my eyebrows. 1,000,000% I have thought of that. Have you seen anybody do that or try that?
So we have a clinical study that's getting started now, where there is postmenopausal women with a hair loss, and we gave them a little brush, a different brush because you don't want to use the same brush every time and dip
Yep.
it back in. And they're actually applying that, and we're doing a study just to see how it works because we're really backed by clinical outcomes. So we don't want to just have one picture on Instagram and say this is the best thing we've ever done. We really want to do a clinical study, understand the dosing and how to use it.
Yeah.
So stay tuned from that study. And they think we'll see from there, what we can do around eyelashes. I think we need to formulate something that's safe and make sure, if something would accidentally drop in the eye, that it would be safe. So these things are all really important. We want to take our time and really do it right. Because again, we want proof, not promise, and be able to deliver.
Absolutely. Under promise and over deliver. That is definitely, I think that as a company, that is definitely how you operate. You give a little bit of a sneak peek, but then the actual product, when it does launch, I, as a perfect example of that, is so phenomenal that it's the gateway to all other things. I love it. So, as a guest on the Bright Side of Beauty, I always ask, what do you think is beautiful?
Yeah. So for me, I think beauty is confidence. And I think that's what we're trying to do every day with what you're doing, what we're doing. But I think genuinely people that walk through the world with kindness and conviction, to me, are very beautiful people. I mean, we have a lot of negative things that go on. And I think that's probably why I love the Midwest and the people in the Midwest. You just see that kindness and conviction and helping others. And that's real beauty from the inside.
I love that. Absolutely. Your heart placement is definitely what shines out through your eyes and into the rest of the world. I love that. Okay, if somebody wants to partner with Rion Aesthetics with plated skincare, how can they get a hold of you? Where can they find you personally? Drop all the ways to connect.
Yeah. So obviously our Instagram account, drop us a DM and let us know if you're interested in carrying plated. If you have questions, I have an Instagram account, Alisa Lask at Rion. So yeah, we're easy to get. Our website, there's lots to learn. There's many good YouTube videos out there as well. If you want to learn more about the business and the science, it's very complicated. And I think that's why we're going to continue to get educated. I continue to learn things every time, I meet with the people that are doing our clinical studies and our founders. But it's a great exosomes are really the future in skincare. And I think I really encourage everyone to do the education. I think they'll see that plated has really set the bar high and made sure everyone can kind of catch up with what we're doing relative to clinical studies, product safety, quality, packaging with refillables, all of those things.
Absolutely. Well, thank you so much for being a guest today. Thank you also for your understanding. This was a long time coming. Actually, the original date that we had this scheduled for ended up being the day that my son arrived. So
Wow.
I'm so glad I listened to my intuition. I knew we should probably reschedule. And now he's here and we were able to connect today and put out this amazing episode. So thank you for joining me. I look forward to connecting with you again soon.
Well, thank you for having me, and congratulations on the new addition to your family. And look at you. I
Thank
love,
you.
you're really a leader in the industry and doing it all. Great mom, great business person, doing a podcast. So congratulations.
I appreciate it. I appreciate it so much. Have a wonderful summer.
Thank you.